Well, Dr. William Lile is a practicing obstetrician, gynecologist, and medical advisor in Pensacola, Florida. He is also a national pro-life speaker, author, and leading advocate of patients' rights for the unborn. In 1999, Dr. Lile bought out a practice of the largest provider of abortion services in Pensacola, Florida. He immediately stopped all abortion procedures and referrals to the clinic. The tools formerly used for abortion became the means by which Dr. Lile illustrated the reality of abortion procedures and the humanity of the preborn baby in the womb. As his passion for the unborn grew, Dr. Lile began to educate audiences about the development and the intrinsic value of human life in the womb. Dr. Lile became affectionately known as the ProLifeDoc, using modern means such as ultrasound, MRI, and photoscopy to reveal not only the life, but the personality of a baby within the womb. Advances in fetal surgery are now performed on the preborn as distinct patients, and as patients, they too are deserving of legal protection. Expert medical testimony is provided to legislative bodies in order to protect the lives of those that are unable to defend themselves. Dr. Lile became the author of a pro-life newsletter and serves over 7,000 pro-life OB/GYN practitioners nationwide. Seeking to educate the public further, Dr. Lile produced God's Miracle of Life, a 60-minute DVD that includes discussions of common abortion procedures while defending the sanctity on scientific, legal, and scriptural grounds. Chemical abortions now outnumber surgical abortions in Pennsylvania and nationwide. As a result, Dr. Lile leads a growing network of 500 physicians who voluntarily perform abortion pill reversals. Dr. Lile believes it is critical that the medical pro-life community provide this life-saving intervention. He is a frequent guest on both television and syndicated radio shows, and he is here now at Springfield Country Club. Ladies and gentlemen, Dr. Bill Lile.
Well, good evening. Thank you, sir. Thank you very much. It is an honor to be here today. When I left Florida, it was 80 degrees. When I got up here, it was 20 degrees. But I am thrilled to be here. My role and my job is to take tools to put in your toolboxes that you can take home 2 hours from now when I'm done. Take them home 2 hours from now that you can use to defend God's preborn. I have been in private practice since 1999, or as my residents will say, since the 1900s, you know? And it was like, it's 1999. But since that time, I've delivered over 4,000 babies, and every one is special. I get to be the first one to pray over those babies when I deliver them, even at 2 o'clock in the morning. And it is an amazing honor. So we have our private practice. My wife and I will go to about 50 different out-of-state events each year, and we have a passion for doing it. She has the rotavirus, and rather than bring it up here, she stayed in Florida, and I thought that would just work out better. But not only am I a OB/GYN, but I'm also have been an instructor with the University of Florida and the Florida State OB/GYN residency programs. And recently I was at the University of Florida College of Medicine, my alma mater, Go Gators, and we were discussing patients' rights. We were discussing how we treat the babies and how we treat patients. But I started off by asking the students, I said, if I have a patient that is in my office that needs a blood transfusion, without this blood transfusion, this patient of mine will die. But then I find out my patient wasn't born in the United States. Do I have a moral and legal obligation to provide them with a life-saving blood transfusion, even though they weren't born in the United States? And the students are kind of nodding their head and kind of, where's he going with this? And I said, all right, say it's a little bit more expensive. Say I have a patient that needs laser vascular surgery. And without laser vascular surgery, my patient is going to die. But also, this patient was not born in the United States. Do I have a moral and legal obligation to provide them access to life-saving laser vascular surgery? And the students are nodding their head even more. I said, oh, I got one more. I have a patient. The patient is in my office. The patient has a tumor called a teratoma on their heart. And if they don't receive life-saving surgery, this patient is going to die. But again, this patient then needs open heart surgery, was not born in the United States. I said, do I have a moral and legal obligation, even though they weren't born in the United States, to provide them access to this life-saving care? And you got to love the back row medical students. I was a back row medical student too. A guy in the back row said, Dr. Lile, he says, here at the University of Florida, we've been taught that a patient is a person is entitled to respect and bodily integrity. If they are your patient, you have a moral and a legal obligation to give them a blood transfusion, provide laser vascular surgery, and to give them open heart surgery. I said, I agree with you. I was taught the same thing when I was here. Plus, I was taught prima non nocere, which is Latin for, first of all, do no harm. I said, the only detail I left out was that when I said they were not born in the United States, all three of these patients were not born in the United States. Yet. Jaws dropped. I said, yeah, these are my patients, and we are treating them for blood transfusions. We are doing laser vascular surgery. We are doing open heart surgery, and they are patients, and a patient is a person, no matter how small. And I'm going to go into details on how we treat these patients in the womb as patients. And he said, wait a second, you said blood transfusions. I said, yeah, we do blood transfusions to babies at my hospital routinely. Well, why? Well, we are doing it as early as 18 weeks gestation, less than halfway through the pregnancy, we are doing blood transfusions. Why? Because from the moment of conception, the baby is a different person than the mother. In fact, half the time, that baby at the moment of conception is a baby boy, very different from the baby's mom, who is obviously female. But the other thing is, moms and babies can have different blood types because their blood does not mix. And sometimes mom will have antibodies which can cross the placenta and start to attack the baby's blood. And the baby's blood count, when it's getting attacked, starts to drop. If we don't give that baby a blood transfusion, that baby will die in the womb. So we do blood transfusions. And people say, well, where do you get that special baby blood? It's not special. We don't go to the nursery and have the baby stick their arms out and stick a little needle in and say, I'm going to need just a little unit. No. If you have ever given blood at your church or your job and you have O-negative blood, we might have used your blood to transfuse to a baby on the inside of the womb. You know what you just fulfilled? You fulfilled the greatest commandment. Because remember when the Pharisees asked Jesus, they said, trying to trick Jesus, like, oh yeah, this is a good strategy. We're going to try to trick Jesus. They said, teacher, what is the greatest commandment? And he said, love the Lord your God with all your heart, mind, and soul, and your neighbor as yourself. If your neighbor needed a blood transfusion or else they would die, would you be willing to give a unit of your blood to your neighbor? Yeah. Well, guess what? We can use that donation and we can save the life of the baby in the womb. We will take a little bit of blood. We'll have it in a syringe. We'll take a long, thin needle, and with ultrasound, we'll guide that needle right through the skin of the mom's belly. With ultrasound, we'll follow it. It'll go right through the skin, right through the wall of the uterus. Baby goes, what was that? As it goes on past. And we will guide that needle right into the umbilical vein. And we will give that baby a life-saving blood transfusion as early as 18 weeks gestation. If we can give a baby in the womb a blood transfusion, does that meet the criteria of being a patient? Yes. And remember, a patient is a person is entitled to respect and bodily integrity. They said, well, wait a second. You said laser vascular surgery too. I said, yes, I do. Anybody have twins here and here? All right. You're twins. Did they always share everything perfectly? Food, toys, everything, absolutely perfectly. No, of course they don't. They're kids. So what happens on the inside of the womb? Well, sometimes you can see with these babies here, they are not sharing the placenta. They only have one placenta between these two, but they're not sharing it well. So what do? One gets real big and one gets real small. And if we don't do something, the little tiny runty one is going to die, followed by the big one. So what do? We teach them how to share in the womb. How do we teach twins in the womb to share? We send our twins to Texas Children's Hospital in Houston, Texas, and they will actually go into the womb with a fetoscope and a laser, and they'll consult Dr. Luke Skywalker. Luke Skywalker goes in there with his lightsaber, and with that laser, he will divide that placenta in two. Just He said, this is your side of the placenta, this is your side of the placenta. Now you two play nice here on the inside. So if we can teach babies on the inside how to share the placenta and all the nutrition, is that treating them as patients on the inside? Yeah, it sure is. And then somebody said, well, wait a second. You were talking about open heart surgery. I said, oh, hold on to your shirt with this one, because this is amazing. I'm going to show you an animation. We asked for permission from the Cleveland Clinic to use their animation so that we could show you what was going on with this surgery. You know what they said? Even though we would do it nothing but shown in a positive light, they didn't want to be associated with somebody named ProLifeDoc. So we were denied by the Cleveland Clinic. So what did we do? We took the next step. We hired our own 3D animator from California. We found a 3D animator in California that was pro-life. You tell me that's not an act of God, you know, all right? So we found this person. What we're going to show you costs thousands of dollars for them to produce because a workman is worthy of his hire. But we're going to show you this. Let me give you the background. On ultrasound, they diagnosed this baby with having what's called a teratoma, a tumor on the baby's heart. And this tumor was growing really quickly. In fact, a baby's heart is only about the size of my thumb, and this tumor was the size of my thumbnail. And the tumor was growing, and if something wasn't done, that baby was going to die. They gave mom two options because the option of doing nothing was not an option because that baby would die. Option number one, they said, you know what, we can deliver your 27-week baby and then we'll have a preemie, but we'll then do the open heart surgery. But now we've got a preemie at 27 weeks and we also have a major heart surgery that's being done. They said, well, I don't really like option number one. What's option number two? And they said, well, option number two, and we feel confident that we can do this, we would like to give you an epidural so that you are comfortable, and then we'd like to perform open heart surgery on this baby on the inside of the womb. Then we'd like to close the womb back up, and then we'd like to deliver the baby at a later date when the baby has healed. What you're going to see is the animation of this procedure, and then I'm going to show you real still photos from this surgery. So what are they doing? They are going to give mom an epidural. Mom is going to be comfortable. They're going to make an incision in the mom's belly. Then they're going to make an incision in the womb. And then they're going to deliver the baby's right hand. And then they're going to deliver the baby's left hand to get access to the baby's chest so that the pediatric cardiothoracic surgeon can do the open heart surgery. But as long as we have the baby's hands out, what was their other plan? Well, mom has an epidural and there's an anesthesiologist taking care of the baby, taking care of the mom. They had a separate pediatric anesthesiologist who said, you know what? I can start an IV in that 27-week baby. I can give that baby fentanyl in microdoses and I can make that baby comfortable. I can even give that baby doses of Norcuron, a paralytic. I know how to do anesthesia on tiny preemies. I can do this on this baby on the inside. So I'm going to walk down here just for a second so I can walk through and point this out to you. This is the animation. And I spent a couple grand on this, so please watch. You know? But here we go. So you see, this is the mom, and there's the baby on the inside, and there's the baby's heart. And you can see there's a tumor, and the tumor is going to be in white on the inside. Mom is going to be given an epidural so that none of the medicine for the mom goes to the baby. And there's the tumor, for those of you over on the right, and starboard side, that was the tumor. So mom has an epidural. They're going to make an incision in the mom's skin. Mom is comfortable. Then they make an incision in the womb right there. Then they're going to bring out the right arm. They're going to bring out the left arm. They get access to the baby's hand. The pediatric anesthesiologist puts an IV in the baby. Baby's getting microdoses of fentanyl and Norcuron. Then the pediatric cardiothoracic surgeon makes an incision in the baby's chest, removes the teratoma from the baby's heart. Almost immediately, the baby's heart starts functioning normally. Then they were able to close up the skin on the baby's chest, remove the IV, put the arms back in, close the womb, and close the skin. And this is at 27 weeks gestation. 10 weeks later, they did a C-section and delivered that baby. That is healthcare at the highest level. Does that meet the criteria of treating that baby as a patient on the inside? Yeah. And a patient is a person, no matter how small. This is the actual surgical team, 12 doctors, nurses, anesthesiologists, and techs that are meeting the needs of both the mom and the baby. Abortion is not health care. I don't care if Bernie Sanders yells it from the loudest mountain, says, abortion is health care, you know, as you don't want to be in range of, he's in the splash zone, you know, don't be in the splash zone of Bernie Sanders. When you have a mom with a heartbeat walk into the operating room and a baby with a heartbeat walk into the operating room. Somebody performs a procedure and then the mom with the heartbeat walks out, but the baby with the heartbeat does not come out. That is not healthcare. Healthcare is when you have 12 doctors, nurses, and techs doing open heart surgery on a baby on the inside of the womb. That is healthcare. We talked about the IV. You've all had IVs placed in your hands. Remember those tiny little IVs? Well, guess what? When your hand's only this big, that it looks like a fire hose. But the pediatric anesthesiologist was dosing that baby just as if that was a 27-week baby that was on the outside. Baby was getting IV fluids, a paralytic, and pain medication. But you know what? It was successful. Almost immediately, the baby's heart starts beating normally. That's the baby's hand. Baby's kind of giving a little point going, y'all did a good job. You know, I appreciate that. And then, well, how did the baby do? Well, that's baby Rylan right there. Baby Rylan is doing great. A patient is a person, no matter how small. That is healthcare at its highest level. Abortion is not healthcare. This young man, if he shows up, he's 24 years old, say he gets in a car accident and he needs blood. Are we going to ask if he was born in the United States? Absolutely not. We're going to treat him. We don't care where he was born. We're going to meet his needs because he is my patient. What about this young boy? Say he shows up in our emergency room. Say he has COVID. Say he has the flu. Say he has the nasty GI virus my wife is getting over. Are we going to ask him if he was born in the United States? No. We're going to treat him because a patient is a person, no matter how small, even when they're 8 years old. Do you remember this picture? This is a picture of a little baby named Samuel Armas. Samuel had spina bifida, and Vanderbilt University was doing a trial. And during the surgery, even though they were operating on his spine, Samuel kind of stuck his hands out to kind of give a high five to the surgeons that were operating on his spine. You know, and like people say, oh, I remember that. That was just a few years ago. You know how many years ago? It'd make you feel like you're aging. That was 24 years ago. 24 years ago is when they did that surgery on that baby in Vanderbilt University. But here's something you don't know. The guy over on the left side, his name is Samuel Armas. The kid in the middle, his name is Samuel Armas. The baby sticking his hand out of the womb, that's Samuel Armas. This is the same person. He is a patient on the inside. He is a patient when he is 8 years old, and he is a patient now at 24 years of age. A patient is a person no matter how small. Our geographic location does not give us or deny us our rights. We're going to cover a lot today, but I got to tell you one story which you're going to love and you're going to take home, and it's going to be a great tool. It's called delayed interval delivery. Delayed interval delivery, and we had a case in Pensacola. Mom came to Pensacola for a Toby Mac concert. She's 25 weeks pregnant, but she wanted to see Toby Mac. She's 25 weeks with identical twin boys, where one egg, one sperm got together, and then before day 13 divided into identical copies. She's at the Toby Mac concert, and she's having fun, praising Jesus. And all of a sudden, we have a baptism down the front because she broke her bag of water. EMS brings her to our hospital, and before we could do anything in our OB/ER, she delivered the first baby. Identical twin baby A goes to our $70 million children's hospital in NICU, all the doctors, all the nurses, and all the technology. The identical twin baby B, bag of water is still intact. So our maternal fetal medicine counseled her and said, listen, we have 2 NICUs here at Sacred Heart Hospital. Baby A is down in NICU A with all the doctors, nurses, and tech. Baby B is still in the better NICU, which is here in the womb. As long as this is the better NICU, we like to keep this baby here on the inside. We like to give you steroids, which are going to help mature the baby's lung, protect the baby's bowel, protect the baby's brain. We're going to give you some antibiotics. We're going to monitor your baby, and we're going to keep this baby on the inside as long as possible. Do we get hours? Oh, yeah. Do we get days? Yeah. There was a case in Tennessee, 6 weeks between baby A and baby B. Identical twins, one born in June, one born in August. Identical twins are going to be one in first grade, one in second grade. You explain that. You know, is this one a little slow? Oh, no, I was born 6 weeks after this one. And it's cool technology, but guess what? The baby that is down in the NICU has all the rights and protection that I would have in a cardiac care unit. The baby, the identical twin from the same egg and sperm, the baby that is still in the womb could go over to New Jersey, New York, Virginia, and if mom were to choose, she could abort legally that baby on the inside. How does one identical twin have rights and protection and the other identical twin that is in the womb doesn't have those rights and protection? Our rights come from God. It's the role of good government to defend those rights that were given to us by God, and that is what we need need to stand up for. You see this picture of Samuel Armas after he got the spina bifida surgery. That was 24 years ago. This was Gen 1. This was like 1.0. You know, like we had the DOS and the dots. This was version 1.0. But then, any nurses in here over the age of 50? All right. Gallbladder surgery. Everybody goes, they cut you in half, they take out the gallbladder, and they put you back together. And gallbladder surgery 40 years ago was an incision from here to here. They take the gallbladder, and you're in the hospital for maybe a week, 10 days. It was rough. Now, how does gallbladder surgery go in? You don't have anything to eat or drink. You show up at the surgical center. They put a couple incisions in. You get 4 Band-Aids. You leave the hospital in a few hours, and you're in the line at Chick-fil-A getting a Happy Meal, you know? I mean, that's how surgery has changed. Well, it's changed on fetoscopic surgery. We're now doing fetoscopic surgery on these babies on the inside. We are now doing spina bifida repair with babies with a fetoscope on the inside. And that was generation 2. But guess what? I'm going to show you not the surgery. We've got the surgery, and it's really cool. But I want you to see what the baby looks like on the inside. We're going to put a GoPro in the womb. I mean, a womb with a view. All right? So we're going to have a womb with a view, and I'm going to show you the baby because it's not an ultrasound. It's not an MRI. This is an actual image of the baby on the inside. So the surgeons are popping in a camera just like they were going to do any kind of a fetoscopic or laparoscopic surgery. The uterus lights up red because there's a camera there on the inside. The camera goes inside, instruments go on the inside. That's what babies look like on the inside. They are not a blob of tissue. These are patients there on the inside, and a patient is a person, no matter how small. This baby is about to get spina bifida corrective surgery with a fetoscope. That is high-quality health care. That is where medicine is going. These are patients of mine, and we need to defend the lives of these patients. That was generation 2. You know what we're now doing? We're doing stem cell corrective surgery on these babies with spina bifida in the womb. Now, where did they get the stem cells from? Because that can be a problem. Well, UC Davis, Dr. Diane Farmer, first they started to use stem cells from abortions, which is horrendous. You don't take the life of one person to help the life of another person. But guess what? Those stem cells didn't work. What stem cells did work? Mesenchymal stem cells harvested from placentas that have already done their job and are about to be discarded. So what is a stem cell? A stem cell is like a 5-year-old. A 5-year-old, you look at a 5-year-old and they can become anything that they want to be. They want to become a priest, they want to become a nun, they want to become a doctor, a lawyer, a teacher. They just need some guidance and direction. That's what a stem cell is. A stem cell is there, I can be anything I want to be, just give me some guidance. So Dr. Farmer thought, what if we take stem cells, put them on a little patch called dura, and then go inside the womb and put that little Band-Aid of stem cells right there on the spina bifida defect on the baby. And then all of a sudden, when she put the stem cells on the defect on these babies, the stem cells are like, oh, this is what I'm supposed to become. I'm supposed to become spinal cord. I'm supposed to grow. After they applied the stem cells to the baby's spine, they saw the feet move. They had not moved. They saw the legs move. What I'm going to show you next is that's Dr. Farmer applying these stem cells to the defect in these babies' spine. That's one of her first patients named Robbie. So that was an $8 million trial, and they were amazed. In fact, it's called the CURE trial because it's not just a treatment for spina bifida. They are really looking at curing spina bifida on the 1,800 babies each year that are diagnosed with spina bifida. Is that health care? That, my friends, is health care at the highest level, and a patient is a person, no matter how small. And it is amazing how we continue to make quantum leaps in how we treat the preborn as patients. So life, you look around, you can't look within 5 degrees without seeing the word life around in this room, and we celebrate life. Well, what does God say about life? Because we are engaged in a spiritual battle, and if we are not using our spiritual tools, we are not going to be victorious. We use our spiritual tools, we can win this thing, and we will win this thing. But what does God say about life? Well, let's go to Genesis. You know, just like, what was it, the Von Trapp family? Let's start at the very beginning. So we're going to start. Let's go back to Genesis. We'll finish up in Revelation, so we're going to be here for a little bit, all right? But we go to Genesis, and after God has made hundreds of billions of galaxies, hundreds of billions of stars, put a little extra time on the earth, all the mountains, all the rivers, all the streams, made Florida hot, made Pennsylvania really cold this time of the year, and they made all the mammals, all the birds, and all the fish, and then it's pretty amazing creation. But then what? God says, you think that's cool? I made all of that, but none of that was made in my image. And then in Genesis 1:26, it says, and God said, let us make man in our image so that we can have a relationship and communicate with God. You might love your dog. Your dog was not made in the image of God. All of us, from the moment of conception, were created in the image of God. You see behind the Bible, and guess who thinks that that Bible is not opened up to Genesis 1:26? Yeah, it's somewhere in the middle, probably in Psalms. But what's underneath of that Bible? The American flag. Why did I put the American flag there? What image represents the United States when we think about our nation? You think about the flag. Have you ever seen somebody burn the American flag? Have you ever seen somebody stomp on the American flag? Well, I mean, I live in Pensacola, Florida. I've delivered 5 of the Blue Angels babies, have not gotten a ride yet. I mean, as far as delivering Blue Angel babies, I'm an ace. I've had 5, all right, but I haven't gotten a ride yet. But when we see somebody that burns the American flag or stomps on the American flag, it makes us just cringe. Well, why are they doing that? When people hate the United States, they can't destroy the United States, so what do they want to destroy? They want to destroy the image of the United States. At its core foundation and basic premise, what is abortion? Since we are created in the image of God at the moment of conception, every one of these babies is in the image of God. If somebody has a hatred for God, they can't destroy God. So what do they want to do? They want to attack and destroy the image of God, and that is the babies in the womb. This is a spiritual battle that we are engaged in. This is not just a choice. This is us going up against evil, demonic, satanic forces. So what does science say about when does life begin? You know, because, you know, they say, well, science and the Bible are different. No, they're not. You know, in fact, if you think they might disagree, wait for science to catch up. Science will catch up with the Bible, and then you'll find that it's right. In fact, God is the author of all science. So all true science will always defend God's pre-born in the womb. Sometimes it's not the science that has a problem, but it's some of our scientists that have a problem, and that's where the issue lies. But where does science say life begins? We're going to show you conception. And it's going to be appropriate for this crowd even to discuss conception. This is an egg. All right, can you visualize the egg here? Ladies, you are so precise and efficient. You make a little cyst in your ovary. That ovary releases that little follicle, and an egg comes out. And you go, boop, and there's the one little egg, and it's floating with the genetic material. Guys, we're not efficient. We're more like Braveheart. All right, we got 300 million of our guys with blue makeup, you know, over here banging their chest and swinging their swords, and it is 300 million who all think they're Michael Phelps. And that's the finish line, all right? So the gun goes off, and we have 300 million Michael Phelps wannabes that are swimming. But guess what? They get up through the cervix into the uterus, and they have a choice. Do I go up to the right tube, or do I go to the left tube? Do we ask directions, ladies? No. So half of these idiots go to the wrong way, and they get to the end of the tube, and there's no egg there at that tube. And the other half go, and they say, there's the egg. So they start swimming. And then one of them touches the egg and says, gold medal. And it's like, It's not the first that touches the egg. It's the one who gets on the inside. So now it's more like an American ninja, where now they have enzymes, they have acrosomes there on the top of their head, and now they've got to get on the inside. So you have thousands of them on the outside trying to get on the inside. But the way God designed it, there is only a gold medalist. You cannot have a silver medalist. You cannot have a bronze medalist. One. So the one gets on the inside, and it's like, okay, there's your gold medalist. Well, how do you keep all the other 150 million from also wanting to go for silver? God took care of this. He designed something called a zona pellucida, and this cell membrane immediately turns into a cell wall. There are zinc ions, there are potassium ions that are flowing, and it's kind of like Star Trek. You know, like you come out of hyperspace and there's Klingons all over the place, and what does Captain Kirk say? He says, shields up. A shield goes up around that egg, and all of a sudden, no more can get on the inside. So now we have one cell. Genetic material from mom, genetic material from dad. But we don't just grow and become one big cell and one big blob. No, we divide from one cell. We duplicate all the DNA. 1, 2, 4, 8, 16, 32, 64. All identical copies. And all of a sudden, one copy says, I don't want to be just like you. I don't want to be like you. So from here on, I've got all of my blueprints. I'm only going to read these pages. I'm more like a structural engineer. I'm going to take care of all the carpentry. I'm going to frame this body. I'm going to do all of the skeletal systems. And another says, we don't have to be just like each other. No. Oh, well, I'm kind of like a plumber. I want to be in charge of all the blood vessels, the arteries, the veins, the heart. That's the part I'm going to learn. And then another says, well, you know what? I'm more of an electrician. I'm just going to read these pages on these blueprints. And I'm going to put all the wiring down, all of the nerves and all the brain. How do individual cells know what their job is going to do? It's called cell differentiation. I can tell you exactly at 26 days what is going to happen in the body the next day. How these individual cells know. I mean, there are whole libraries filled with the anatomy and books about how we are all developed. How do these individual cells know? Because there was an amazing designer named God, an amazing creator who put all this together. We can't tell you and begin to tell you what's going to happen, but God knew exactly how it was going to be. It's called cell differentiation, and it is an absolute miracle. And it did not just evolve that way. That was created that way, and that was designed by God that way. When it comes to that moment of conception. So what happens? Can you see that moment of conception? Yeah. When you see all that depolarization of potassium and zinc ions going on. If you look at the right frequency of light with mammalian cells, you can actually see a flash of light at that moment of conception. I'm going to show you this image. At that moment of conception, see those flashes? That's the moment of conception. So when somebody says, well, we really don't know when life begins. My gosh, you have a flash of light going on. What more do you need, genius, you know? That is the moment when we were created in the image of God. Jesus is the light of the world, and that flash of light, I just says, this is a new person created in the image of God that I am here to defend. So when you see somebody hold up a sign or chant this and say, it's my body, it's my choice, it ain't your body. Your body is an amazing life support system for this baby. For from that moment of conception, that one cell is different from the mom, different from the dad. That one cell is different from the other 7 billion people that are here on the planet. And half the time, that one cell, instead of like the mom's 60 trillion cells, which are all XX chromosomes, all of a sudden that one first cell is XY chromosome. And every cell after that, when it's multiplying and going through cell differentiation, also is XY chromosome. You know how many cells there are in these developing babies just at 10 weeks? 1 billion cells. So how at 10 weeks can she have 1 billion cells that are all XY and say, it's my body, it's my choice? No, I'm sorry, you are wrong. You are scientifically wrong, and we will correct that, and we will defend that little person there on the inside. Ever been to a gender reveal party? I mean, they're fun. Are we having a party on whether this is going to be a boy or going to be a girl? We are having a party on what this baby is right now. It used to be you had to wait till about 18, 20 weeks until an ultrasound. You could say, oh, boy parts, girl parts. Do you know now we can actually do a blood test on the mom, what's called cell-free DNA, and we can actually look at little fragments of the baby's DNA. 7 weeks after conception, a simple blood test on the mom, and I can tell you with more than 99% accuracy if that is a boy or that is a girl. You think, well, how could that test possibly be evil and be used for wrong? Because say somebody doesn't want to have a boy. Say somebody doesn't want to have a girl. They still have time to get the abortion pill because the abortion pill will abort a baby 98% of the time up to 10 weeks gestation. Genetically, this is a new person, unique from mom and unique from dad. But then we have tools. We were going to give you tools. I've told you stories. But then we have the tools as far as the technology. My daughter is 25 years of age. This is her 25 years ago on an ultrasound. She's only 12 weeks along. She's only about that big. There is no Bluetooth. There is no Wi-Fi. There is no iPhone. There is no watch. So what do? It's old school. You jump and you slide. You jump and you slide there on the inside. But now we have technology called MRI. Have you ever seen an MRI of a baby on the inside? I mean, MRI is pretty amazing. There's no radiation with an MRI. We use it for doing different imaging. And I'm going to show you an image that I just love because it doesn't just show the person on the inside. It shows the personality on the inside. You know, I've had patients, whenever a pregnant mom comes into our office, I have 2 patients. If she has triplets, you know, I've got 4 patients, and we've had quintuplets in our office. So when a mom comes in and she's pregnant, I'm taking care of 2 patients there on the inside. And the first question you always ask is, how's your baby doing? Is your baby moving around well? And I've had patients say, this baby is just doing the castanet dance on my cervix. I'm like, I'm sure they are. I'm sure they. Then I saw this. You know, have you ever, let's say the national anthem is going on. Oh, say, can you see? Well, guess what? This baby's saying, I do not kneel. I do not sit for the national anthem. As God is my witness, I will put my feet on my mom's cervix. I will grab onto her sacrum, and I will push and push and push, and I will stand up on the inside. These are the personalities and these are the lives that we are all unified together. Whether you are 80 years old or whether you are an 8-year-old here, we are unified in defending God's preborn, created in the image of God at that moment of conception. You know, abortion is an evil, but there's another evil. For the first time in a 12-month period, we lost 109,000 lives due to narcotic overdoses. I mean, I know this is Puritan, Pennsylvania area, but Florida, we got a problem with something called fentanyl. Has fentanyl made its way up here? Yeah, it's made its way everywhere. I mean, our canine units carry the antidote Narcan because their dogs sniff a bag of fentanyl and the dogs can overdose. So they have fentanyl for the dogs even involved. But we lost the lives of 109,000. You ever watch those videos from Kensington Avenue as far as what's going on right here in our own backyard? It is sad and nothing is being done about it. But does everybody who overdoses on a narcotic die? No, because we have the antidote. We have Narcan. And Narcan is like, it's like Sleeping Beauty. I mean, you have a patient, they are not responsive, they are out and they will not respond to anything. You give them a little bit of Narcan and they will practically sit up and finish the sentence that they stopped before they overdose. It is an amazing medication. We keep it in our church. I mean, we added AEDs in our church a few years ago because, we had a little bit of an older population. So zip them on back and let them take the offering, let's get this thing going, But now we have to put Narcan in our AED cases because we have a lot of people who are drug dependent and we want to be able to help them immediately right there. Well, when it comes to other evils besides just narcotics and fentanyl, and now we have other medications that are coming across our border and killing our kids, now we have to deal with the abortion pill. And we're going to spend a little bit of time on the abortion pill because I've traveled all around the country. There are a lot of pastors, there are a lot of priests who don't know the difference between the morning after pill and the abortion pill. There are a lot of directors of pregnancy resource centers who don't know the difference of the morning after pill and the abortion pill. So we're going to make you guys experts. We were here tonight. Our goal was to give you guys new tools that you can put in your toolbox to defend the preborn in the womb. The morning after pill. It is still evil, and if a woman happened to get pregnant that night, it will cause her to have a menstrual cycle and she will lose that pregnancy. Morning after pill is indicated for taking the morning after. All right? How is that different from the abortion pill? Because the abortion pill is not the morning after. It is for the 70 mornings after. The abortion pill is indicated up to 10 weeks gestation. There are already studies looking at 12 and 14 weeks gestation. It is 98% successful in killing a baby in the womb up to 10 weeks gestation. It is now not only available at abortion clinics, but now we see it over at Walgreens, we see it at CVS, and we see it at Rite Aid. It is just horrible. And you know what? It's also dangerous. And let me tell you, we're going to go into it. Why is it dangerous? Because the #1 pregnancy-related killer of women in the first trimester of pregnancy is a ruptured tubal pregnancy. 1% of all pregnancies will be an ectopic tubal pregnancy. We are over and over again seeing case reports of young girls who were pregnant. We're scared. They maybe got the abortion pill with mail order. They maybe just got it from a clinic or from a pharmacy. They take the abortion pill. And what do they tell them? You took the abortion pill. You're going to take a few more pills the next day. It's normal to have bleeding, cramping, and pain. Did they do an ultrasound to see where this pregnancy is? No. What are the symptoms of an ectopic, a tubal pregnancy? Bleeding, cramping, and pain. We are seeing case report after case report after case reports of girls. I was just reading the case of a 26-year-old girl. She was 8 weeks pregnant. She took the abortion pill. She had bleeding, cramping, and pain. 3 days later, she was brought to the emergency room unresponsive. They could not resuscitate her. They did a postmortem. She had a ruptured ectopic pregnancy. When they are so focused on just killing the baby, they are forsaking even basic health care for these women, and women are dying. That is what is happening with the abortion pill. How rare is the abortion pill used? No. It is now the primary method of abortion here in the United States. In some countries in the EU, up to 90% of all the abortions are performed with the abortion pill. It is 54% at least of the abortions here in the United States. In California, it is at every health center in all the state schools, colleges, and universities in California. It is available health center. Abortion is not health care. It has no business being in a health center. So it is horrible, it is bad, but is it reversible? Do we have a way, an antidote for the abortion pill? Yeah, we sure do, and it's called abortion pill reversal. When you look at the abortion pill, how does it work? When a woman becomes pregnant, there's this hormone called progesterone. When you can't understand a big word, break it down. Progesterone. This is the progestational steroid hormone. This is the hormone in pregnancy that says, hey, congratulations, you're pregnant. We got to soften the uterus, allow it to grow. We have to make the cervix close so it doesn't open up. We're going to divert more nutrition and resources to the baby. It keeps the pregnancy going. In fact, we use progesterone all the time in normal obstetrics because we use it when a mom has preterm labor. If she's had recurrent miscarriages, we give her progesterone. Progesterone is good for the pregnancy. So when a woman realizes she made a mistake and she took the abortion pill, her progesterone levels were going up. She takes the abortion pill, now her progesterone levels are going down, and if something isn't done in about 3 days, that baby is going to die. I scuba dive. It would be like turning off my scuba tank while I'm down there at the bottom. I'm breathing on, and then you have the abortion pill and it turns more to, and over 3 days, it will take the life of that baby on the inside of the womb. How do we reverse it? We had the progesterone levels going down. We just give them progesterone and we bring those levels up. We bring those levels up and we bring them to normal, and that baby is healthy and that baby does not have an increased risk of birth defects. We are saving lives with abortion pill rescue. We have a network of over 500 doctors that we have trained nationwide. In December of 2022, we documented reversal number 4,000. I've attempted reversals now 17 times, and we have been successful. Healthy moms, healthy babies, 14 of those 17 times. How much does it cost us? It costs us $109. This is one of my first successful reversals. You know, when a mom has made a bad decision, anybody here ever made a bad decision? You ever said anything that I'm like, why did I say that? All the guys are going, yeah, and all the wives are giving them elbows and looking at them going, yeah, you do that all the time, you know? When we make bad decisions, and we all do, isn't it great that we have the opportunity to reverse some of those bad decisions? So when a woman calls our network, there's a hotline up in Columbus, Ohio. We work through the hotline, we get all the information, and we call in the abortion pill, reversal medication, the antidote. My wife and I pay for it all the time. This is one of our first successful reversals. We recently had a patient who contacted, the baby's name is Journey, because this baby had a long journey. But we got a call from a mom, 26 years of age, and she was 9 weeks pregnant. She lived in Destin, Florida, if you've ever been to Destin. Beautiful resort area. And she was panicking because she was 9 weeks pregnant. She called the closest abortion clinic, which was up in Tallahassee. They said, well, we can't get you in for 2 weeks. She goes, I got to get there this week because I'm already 9 weeks pregnant. I want the abortion pill. They said, well, the best thing we can think of is call Jacksonville. She called Jacksonville. That is a 4-hour drive to Jacksonville. She drove 4 hours to Jacksonville. She signed the consent. She swiped her credit card. She took the pill, and she's driving back on Interstate 10. She sees a billboard. Billboard said, your mom chose life, you should too. She sees a second billboard. That billboard said, heartbeat at 18 days. She pulled over, called our network. The nurse called me. I spoke with her, and I said, is this your pharmacy phone number in Destin? She goes, yes. I said, you just keep on driving. I will see you in my office on Monday. She was now driving thinking, did I do something that killed my baby? Did I make a choice and my baby is going to die? We saw her in our office that following Monday, and that's her thought. She's sullen, she's morose. Did I kill my baby? We quietly walked her back to the ultrasound. We did the ultrasound, and guess what? We saw a heartbeat. Guess what else? She told her boyfriend. Her boyfriend 1 month later proposed to her. 2 months later, they got married. I delivered that baby. What did they name the baby? William. All right? You can't write stories better than that. So is it a choice, or is this a spiritual battle that we are engaged with? If we don't realize that this is a spiritual battle, we are not going to be victorious. What does it say in Scripture? Jeremiah, God's talking to Jeremiah. And God says, Jeremiah, before I formed you in the womb, I knew you. Before you came forth out of the womb, I set you apart, and I ordained that you be a prophet unto the nations. God knew us all in the womb, and God had a purpose for us and a goal for us. The psalmist said, you knit me in my mother's womb. When it comes to Can we win? Absolutely we can win. It is a spiritual battle. But we don't just go in wearing tank tops and shorts. We go into the spiritual battle with what Paul said, put on the full armor of God, because this is not a choice. We are going up against Satan himself. Satan, what are his tools? What are his goals? He wants to kill the image of God there on the inside. That is his goal. So when we see abortion clinics and the baby is aborted there on the inside, Satan cheers because that was his goal, to destroy that baby. When we see somebody take the abortion pill, Satan cheers because he knows in 3 days that baby is going to be dead, and that image of God is going to be dead. So how do we engage? We put on the full armor of God. We have one offensive weapon, which is the sword, and that is the Word of God. We've got to know the Scriptures, and we go in with the full armor of God to engage in this battle, because I love to fight. I love being competitive, but you know what? I love to win too. And every time we have a mom who goes into a pregnancy resource center contemplating about an abortion, and she's shown the truth and she is given love and support, and she changes her mind and she keeps that baby, Satan is defeated. Every time a woman takes that abortion pill and then through the abortion pill hotline, she receives the antidote and that baby's life is saved, that is a victory. How do I know we can win this battle? Because we already are. You see the pro-life legislation, you see the students, you see a whole army of young people over here on this side. We are going to win this battle. Why do I really know we're going to win this battle? Because 2,000 years ago, Satan thought he had been victorious. He had Jesus beaten, he had Jesus scourged, he had him put up on the cross. He was up on that cross for 3 hours, and they mocked him and they laughed at him. And then he gave up his last breath and he said, "It is finished." They thrust a spear up into his side, blood and water poured out, and they laid him in the grave. And Satan rejoiced because he had killed Jesus. But guess what? 3 days later, that stone was rolled away. The women went there, and did they say, "You lay the ointments on him"? No. Jesus was alive, and they yelled, "He's alive, he's alive." So if Jesus can conquer death, that is a defeat of Satan. So does that tell me that we can win this battle? Absolutely. How do we win this battle? Do we use science and technology? They can help. Do we share the love of Jesus? Absolutely. But the real victorious weapon that we need to use is the gospel, because it is the gospel that changes hearts. It is the gospel that changes minds. It is the gospel that changes behavior. And it is with the power of the gospel we will save the lives of God's preborn. And in return, we will heal this land. God bless you all, and thank you very much.
God bless you.